Today in this video, we're going to talk about what uterine fibroids are, what the causes or risk factors for developing uterine fibroids, what the typical signs and symptoms are, and of course, most important to you, how can we treat uterine fibroids, hopefully without surgery. So let's get down to it. Uterine fibroids, also called a leiomyoma or sometimes just shortened as a myoma, are a benign, meaning non-cancerous tumor or lesion in the uterine wall. These benign cancers, even though they are not cancerous, can cause significant impacts with quality of life and the day-to-day activities of females suffering from uterine fibroids. These tissues are a mass, like a firm mass, that take up space in the uterine wall. These lesions can be small, sometimes as small as 1 centimeter or less, or they can be quite large, like the size of a grapefruit, and sometimes even larger. Women can have 1 fibroid, or they can have sometimes up to 10 or more fibroids, causing a huge impact on the size of the uterus. You can imagine with a size of maybe 2 or 3 tennis ball size, sometimes even softball size masses or lesions down in the lower abdomen, you're going to start having some significant symptoms. Not every woman with uterine fibroids actually has symptoms. So in the early stages, uterine fibroids may be diagnosed incidentally or sort of by accident. Once the patients start to develop symptoms, we start to see symptoms as severe as heavy menstrual bleeding that can be associated with large blood clots. We can see irregularities in the patient's period cycles, where maybe the period cycle is just not predictable anymore. We can see menstrual cycles between menstrual cycles, where maybe a woman bleeds for 5 to 7 days and stops bleeding for a week and then starts bleeding again. We can also see an increase in just the number of days of the menstrual cycle. I heard a girl last week tell me that she wakes up 30 minutes to every hour at night to change pads and tampons. I hear about women wearing diapers sometimes because of their heavy bleeding. A lot of women that have been bleeding like this for long periods of time don't even realize how significant they're bleeding and how abnormal this is. Heavy uterine bleeding sometimes can also lead to anemia. We see women with terribly low hemoglobin levels where they have iron deficient anemia, and this can lead to serious health concerns. So if you are suffering from heavy menstrual flow and you've not had this diagnosed, it's time to find out exactly what's causing this heavy flow or heavy menstrual bleeding. So in addition to heavy menstrual bleeding, the second most common complaint is pelvic pain, pain down in the lower abdomen. This can be just as simple as just discomfort or pelvic pain. It can be associated with bloating. It can be associated with lower back pain, pain that sort of shoots to the lower back during your menstrual cycle. And then the third most common complaint we see are what's referred to as bulk symptoms. So remember, we talked about the size sometimes of these uterine fibroids, the fact that they're a mass. When the uterine fibroids start to get large enough, and depending on where they are located in your uterus, they can actually push on the bladder wall. They can also push rearward into the spine and pinch the colon. So physically speaking, these uterine fibroids can literally apply enough pressure to cause frequent urination and sometimes the feeling that you're not completely able to void your bladder. Also, similarly with the colon, if the fibroid gets large enough and literally pinches off the tube of the colon, everything can start to get backed up and you may start experiencing symptoms of constipation. So you can start to see how the symptoms of uterine fibroids can be extremely unpleasant. Another potential complication with uterine fibroids can be infertility. Now, this doesn't happen in every woman with uterine fibroids, but it certainly can be a cause for infertility. So let's talk now about why we get uterine fibroids or what the risk factors for uterine fibroids are. So it's not completely understood on why women develop uterine fibroids. However, we do know that there is a number of things that can contribute or make you more likely or predisposed to having these uterine fibroids. The number one thing that we see is a family history or predisposition to having uterine fibroids. If your mother had uterine fibroids, you are 300% more likely to have uterine fibroids. That's a 3-fold increase from just the normal population. As women age, hormone levels obviously change, And fibroids are very receptive, or have receptors on the fibroids or in the fibroids that are sensitive to hormones like progesterone and estrogen, which is why age is a huge increased factor for uterine fibroids. So the older you get, still within the ranges of childbearing years, so let's say 35 to 50, the older you get, the more likely you are to develop uterine fibroids. Another huge risk factor is obesity. So being overweight is the big risk factor. We don't completely understand the link between obesity and having uterine fibroids, but it may have something to do with the inflammatory types of foods that patients eat. So diets that are high in red meat, or sometimes even being low in vitamin D can be a higher risk factor for developing uterine fibroids. One of the other huge risk factors for fibroids is ethnicity. So if you had immigrated from Africa, or your parents were straight from Africa, this leaves you at a significantly higher increased incidence of having uterine fibroids. We also tend to see in women of color more fibroids and larger fibroids with worse or more heavy symptoms related to uterine fibroids. So what are treatment options for uterine fibroids? Well, maybe the easiest treatment is just waiting until you get to menopause. So we know that as women age and as the progesterone and the estrogen levels start to decrease, fibroids will actually shrink naturally on their own. So you can and will get rid of uterine fibroids naturally. But I know that that's not completely realistic, and sometimes with the severity of your symptoms, that's not something that's really practical or easy to do. Remember, we also said that not every woman with uterine fibroids actually has symptoms. The incidence in the African American population can be as high as 80% have uterine fibroids, but it doesn't mean that all 80% of these women actually suffer from symptoms related to uterine fibroids. So just because you've been diagnosed with uterine fibroids doesn't mean that you're actually going to be having symptoms and need to do anything about it. Sometimes these fibroids, I see women with 2, sometimes 3 fibroids that are each the size of sometimes a tennis ball and sometimes the size of a grapefruit. And when you have 2 or 3 of these fibroids increasing the size of the uterus, they are going to start pushing outward and cause the belly to distend. So one of the things that you can do or look at is lie flat on your stomach and feel and poke around on your lower abdomen and see if you can feel anything that feels lumpy or feels like you have a mass. That may be an indication that you have a uterine fibroid. So some of the first-line treatments for uterine fibroids are going to consist of medication management. Medications typically are going to consist of some sort of birth control medication. A birth control like an oral contraceptive, maybe even an implant, the implant that goes in the arm, or sometimes even an IUD. These treatments can certainly improve bleeding. They can certainly improve the irregularity of the menstrual cycle, maybe even improve the blood clots. But a lot of women that I talk to are very resistant to want to take birth control medications, mainly due to the increase in risks. We have increased risk of stroke, not only stroke, but also blood clots. And then we have some really unwanted side effects like weight gain. So if you're already struggling with some increase in weight gain and maybe distension of your belly from the uterine fibroids, sometimes the last thing you want to do is go maybe hop on a birth control medication that would actually make you gain weight even further. The most common recommendation that we hear is obviously a hysterectomy. So this is the only known cure for uterine fibroids. Let me say that again. It is the only cure for uterine fibroids, is to completely remove the uterus. So if you remove the uterus, there is 0 chance your fibroids will ever come back. So obviously that comes at some risk. So there's not only risk, but potential unwanted complications from having a hysterectomy. And just the fact that the hysterectomy is an organ that we don't necessarily need to remove unless maybe the woman is higher at risk for certain types of cancers, uterine cancers, ovarian cancer, maybe cervical cancer. So these are all the things that we discuss in our consultation process about the treatment that we provide, which is a non-surgical alternative to hysterectomy. The second most common recommendation for patients with fibroids is a procedure called a myomectomy. This is a little bit less invasive form of a hysterectomy. This can be done robotically, it can be done in a more minimally invasive manner, but still is going to involve an invasive surgery where there is going to be a number of scars around the belly. But basically with this treatment, it's not suitable for every patient with uterine fibroids. The reason is sometimes the fibroid can be too large to remove robotically, or maybe there's just too many fibroids within the uterus. It wouldn't make sense at that point to try to just cut out 1 or 2 fibroids. If there was 5 fibroids or maybe 10 fibroids, there's a limit to how much tissue you can remove from the uterus before you just need to say, okay, we just need to remove the entire uterus altogether. One other recommendation for uterine fibroids is called an ablation. There's 2 types of ablation. There's an endometrial ablation, where basically a probe is inserted intravaginally through the cervix and into the cavity or inside the womb of the uterus, and the endometrial lining is sort of basically heated or cooked. This isn't obviously an option if you're still thinking about having children, but it can help improve symptoms of heavy bleeding and heavy menstrual flow. There's also a intravaginal type of ablation where a probe is inserted into each fibroid sort of one at a time and cooks the fibroid from the inside out. Now let's talk about that treatment alternative to hysterectomy that your OB-GYN probably didn't tell you about. At ARV Centers, we offer a treatment called Uterine Fibroid Embolization, often called UFE. UFE has been FDA approved for, get this, 25 years. 25 years this has been around, and you probably haven't even heard of it. Uterine fibroid embolization is a safe, effective alternative to hysterectomy. UFE carries just a fraction of the risk that we have compared to surgery like hysterectomy or myomectomy, and can get you back on your feet, back to work in as little as 3 to 5 days sometimes, at worst probably a week. In comparison to hysterectomy patients typically take anywhere from 4 to 8 weeks to get back to full physical activity. So if you're suffering from uterine fibroids, or you're having symptoms of uterine fibroids like heavy bleeding, pelvic pain, bloating, increase in weight gain, anemia, then call ARV Centers today, schedule a free, no obligation screening. We'll take a look and go over your full detailed history. We'll discuss what diagnostic tests we need to run in order to properly diagnose your fibroids. We typically use MRI imaging for just about everything, because it also helps us diagnose a lesser known condition called adenomyosis. After we get the results of your imaging, we'll discuss how many fibroids you have, where they're at in your uterus, and how large they are, and if you're a potential candidate for UFE or uterine fibroid embolization. Thank you for watching this video today. Please like and subscribe and share this video if you feel like you've learned something great. And hopefully we look forward to seeing you at ARV Centers soon.